I'm rolling out on a call. Are you down to meet me at the high school?
Yes, I can meet you there.
Okay, so the situation is we have a 16-year-old girl who was self-harming in the bathroom. She's made statements about suicidal ideation. She's currently in the counselor's office.
Mobile Crisis is it's a community-based service, meaning if someone's experiencing a behavioral health crisis, we have teams that will respond right to you. It could be in a home, in a shelter, in a parking lot, wherever the crisis happens, we have teams that will come to you, talk to you, figure out what's going on, and then determine what care is needed at that time.
The Mobile Crisis Team has been established here in Placer County with the adult systems of care, and their team is still running strong and amazing. And recently, Children's System of Care incorporated their own Mobile Crisis Team as well. And so now we partner with ASOC and CSOC, Adult Systems of Care and Children's System of Care, and we've integrated into a full team that responds out.
We get referrals from law enforcement, from concerned family members, from concerned friends. We get a lot of self-referrals. Other clinics in the community refer patients. So we really get referrals from anyone and everyone.
We meet people where they are at. If you're having a crisis at home, we will come to your home. If it's at school, we will come to your school. If it's in your work parking lot, we will come to you. I've personally responded everywhere, from parking lots to schools to houses. We've showed up in hospitals before.
Not everyone can come to the clinic. And especially if you're in crisis, it just makes it that much harder to find the energy or to find the resources to get the help that you need. So having folks that can come to you and help brainstorm and just provide like a listening ear, I think really breaks down some of the barriers that people experience.
Feeling depressed, feeling suicidal, they're looking for support.
We have a mental health professional. The teams are always in two. We're always going out in two to help someone. There's a mental health professional, there could be a registered nurse, there could be a peer advocate or someone with lived experience or a family member with lived experience. And so these teams go out and each have different roles to really we sit down and we talk to the person and we find out what's going on.
When you're dealing with something and you're dealing with a crisis, it's kind of nice to know that you have somebody there that's maybe been through something that's similar to what you've been through, or has an understanding of what it's like to have a kid be put on a hold, or have, just whatever that crisis is, and just to know that they're not alone. I do have my own lived experience. I have 5 children, and out of my 5 children, 2 of them have been in and out of services. I wish back in the day, when a few of the times that I had made calls for my kiddo, that I had this team. Because they are so awesome to come in, and it's so nice to feel like you have support and you're not going through it alone. And I hope that we can give that to the families.
Part of what we do is provide some hope that there are places to turn. No matter what, there is hope, and we can direct them to the level of treatment that they need.